We can also do the exact same procedure, but instead of just having a fairly easy contraction of the pelvic floor muscle, we can really go into a greater effort by asking the person to do a straight leg raise. So for someone who's pregnant or really weak, maybe you want to prefer to modify your straight leg raise. But if the person is able to, just have both legs down and really lift the leg so that it brings a lot of effort, a lot of intra-abdominal pressure, and look at the behavior of the linea alba from that spontaneous action. So a person lifts her leg, you see tightening and a little winding of the linea alba, then you know you have proper contraction, proper recruitment of the abdominal wall, good tension in the linea alba. So this means this effort is really efficient in that person because she lifts the leg, the muscle contracts strongly enough, the force goes through the linea alba because it's stiff enough. So you have everything you want to be able to do that nice physical effort. In the opposite, if you find that when the person lifts her leg, you get that collapsing of the rectus muscle and you get that, you know, not the tightening of the linea alba, but the sagging or even like the bulging of the linea alba, then you know that you're not having that strong muscle contraction to really have that force transmission through the linea alba. So is it poor strategy or is it weakness? Well, to discriminate between the two, do that again, but ask a prior contraction of the pelvic floor muscle and deep abdominal muscle to see if the muscles really kick in well. Do we see a better behavior at the linea alba during the straight leg raise? So you get that prior contraction, you lift the leg, what do you see? If then it gets stiffer, maybe a little wider, then you know it was not weakness, it was just a motor strategy that was not the most efficient for that task. But if it's still collapsed, you still see that sagging, then you know it's probably a task that is too hard for the muscle strength that is there at the moment. So you want to address that weakness and maybe less of that strategy.